Imagine the stress of working on the front line of this relentless pandemic. It's left healthcare staff exhausted, broken and desperate to find any way they can to make it through. We've been to Newport and to Bournemouth to meet two doctors who've taken up their cameras, capturing the highs and lows of this unrelenting fight against the virus and the daily battle to save lives. As they came off shift, we caught up with some of the staff featured in these striking images who are living this crisis on the front line.
Some of the public have their opinions and they think that they know a lot about coronavirus, but the truth is that they don't. I come home after work and I cry, I worry, and I can't sleep. I don't think any of us are ever going to forget this time for the rest of our lives.
One of the ways that I have, I suppose, dealt with this extraordinary challenge that we've been faced with is through taking my photographs and trying to tell the stories of the individuals, the unknown and the unrecognised people who keep the NHS running.
It's the simple thing of photographing the mortuary, seeing it so full, brings it home. And I think anything I can do to help the Trust be able to record this. I've never known a time like this in the health service, and I think we should be recording it.
The first time I had to pick up a patient who passed away, you'd think, who is this person? Who am I taking? And it's quite a frightening thing to have to do.
It is a shock to have a person coming in who's almost 40 years younger than me die of COVID.
Certain patients, you just can't make them better. You find that somehow much more harder to deal with because you know that they know what the outcome's going to be.
I had to make the phone call to a patient's mother to tell her that her daughter had passed away, and that was such a difficult thing to do. And she actually asked me, "Can you give her a kiss from me? Can you please cut a lock of hair for me to keep?"
I had a patient who was positive for COVID. The tears were just streaming down his face, and his daughter's on the phone and she's saying, "Just keep going, Dad, just keep going." That's when you think, this is something else. This is something that you're going to remember in your profession for the rest of your life.
More of our patients are dying in the second wave than they were in the first wave, and as you can imagine, that is immensely difficult to cope with for a workforce that is already exhausted.
People just outside just need to know it's real, and they need to know that there are people that I work with who are inspirational, who are special, who are struggling.
I don't want to sound really selfish, but sometimes I just think, I don't want to do this anymore.
I'm supposed to be on a gap year now, and so a year ago I would not have thought I would be here. Seeing what I'm seeing, doing what I'm doing is going to stay with me for a long time. I'm going to think about it for the rest of my life.
The NHS Frontline, filmed by the doctors who work on it. And that's all we have time for this evening. We're back 7 o'clock tomorrow.
Until then, that's Channel 4 News. Good evening.